because he changed,
I'd like to call the Brunswick County Board of Commissioners regular meeting to order for April 21st, 2025. Mr. IT, can we get rid of that echo?
Yeah, once is enough.
Yeah. I appreciate it. The invocation and pledge, if you please rise, gentlemen, remove your caps. Lord, we thank you for letting us assemble this evening to do the business of the people of Brunswick County. We ask that you guide us and direct us to make wise choices for the citizens. We ask that we maintain our decorum in this room and up here, and that everybody acts as gentlemen and ladies. We ask that you watch over all of our first responders, keep them safe at all times. We ask these things in your most holy and precious name. Amen.
Amen.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
thank you all. All right, I need my glasses. All right. Any adjustments to the agenda? If not,
Yes,
Yeah,
go for it.
okay.
we have an adjustment.
Yes,
Okay.
I would like to remove number 5, modifications to the contract and the purchasing policy. Table it for the next meeting.
I'll move approval with those changes if no one else has changes.
Any comments?
Second that.
All those in favor, please say aye.
Aye.
Any opposed? Okay, any other adjustments? If not, I need a motion to approve the agenda with this change.
I thought we just
That's,
did it.
that's what I just did.
And a second.
We didn't vote
But my motion was to approve with that change, with that removed, so.
on. Oh,
And I
okay,
gave you a second.
We can do it again.
okay.
It's a turbo motion.
Yeah, there you go. All right. Let me mark this. All right, public comments. All right, this is the time for you to come up and speak and tell us your concerns. Each person has 3 minutes. So I only have 2 names on this list this evening. So first up, Marcus Daniel.
There's a individual, Mr. Marty, I don't see him.
I'm right here, sir.
Marty's right here.
Yeah, okay, Marty, yeah, good.
Sir, could you approach the podium and tell
Yeah.
us your name and street address?
Marcus Daniel Stanlin.
If you can approach the podium up here where the microphone gets you, yes.
Because that records everything.
I'm Marcus Daniel Stanlin. I go by Dan. Marty Cook knows me very well. Almost 22 years ago, I addressed this county when the Honorable Mr. Sanford was living that evening. And he was back over there at the cafeteria over there. Anyway, I was honored to speak before the county commissioners on slander of title and fraud. And this fraud was mainly what has been going on for a number of times against the Emma Hazel Gore Stanlin, which I'm the executor of her estate, and then the Skylar Daniel Stanlin, this is my parents' estate. And I can sure tell you that there's nothing been done as of that meeting. We're getting close to 22 years. You will not believe this. The corruption has got so bad that a judge teamed up with a felon that John David over here prosecuted over in Columbus County. His name is Daniel Adam Rooks. And I'm not the only one that he's defrauded. Matter of fact, he and a judge by the name of Carmichael out of Lumberton and Judge Disbrow absolutely, without me being noticed, ended up given a order to vacate me out of my home. That home has been for me for 60 years. And I can tell you right now, this document right here, signed by this judge, you're welcome to see it. I'm not kidding.
That's right. Give it to the clerk over here.
The clerk.
Okay, this document right here tells it all as of to this minute, who's the owner, 1840 Beach Drive, Southwest Calabash. That has been my home for 60 years. You have no clue, Mr. Chairman, and Marty knows, but you have no clue because this board right here is not at fault as to what's been going on because you're the latest board. And I can tell you right now, it's public corruption up here where certain officials that are in law enforcement have denied us for almost 22 years due process of law. And one of the biggest individuals that was involved with that, he is no longer a sheriff. And it really started with Ronald Hewitt, and then Rex Gore's involved, and then coming on up to John Ingram the fifth. I can tell you it's close to 30 to 35 serious crimes, one of which was reported to Mr. Marty Cook and Mr. Sanford and the rest of the county commissioners with typed up documents. I know I don't have much time here. That night on 7/7/2003, when I spoke on slander of title and fraud, which was carried out by, at that time, predominantly Douglas Wayne Stanley, hooked up with these so-called law enforcement up here. And I can sure tell you, Ronald Hewitt, as I said, Rex Gore, then it comes on to Sheriff Ingram, and it comes right on. And by the way, at this very minute, for 2 years, how would you like to feel that someone did not notice you, sir, and put documents in the clerk's office? Miss Katie knows first, well, I'm about ready to close with this. She knows firsthand that I did not get noticed. Daniel Adam Rooks fabricated all the way through with these two judges, claiming every page of Sealand of OIB, comma LLC. You have no clue. Twice now, the same
We need to wrap
person, I'm
this
about
up.
ready to close right now. Twice now, that same person, first time cost me $29,000 to get a order before, and the one that you see right there. And I am the actual owner of that property, and I can tell you, I know law. I've been to federal court and all this stuff and recovered with Douglas Stanley. I'm gonna close right here. We couldn't get no due process law in this county, but we went to the federal government. Douglas Stanley absolutely was found guilty of a felon for stealing and selling 17 parcels of property, $2 million worth. He got he got $500,000 for doing it. He sold it to a straw man in a Bruce or something is the guy's name in Charlotte. And I can tell you, we could go on and on, but when you understand
Not
this,
going to, Mr. Stanley.
I'm closing
Gotta
right
wrap
here.
this up.
I'm
You
closing
said that
right here.
6 times.
at this moment, the fraudulent POA that Douglas Stanley fabricated, he couldn't do that on my mother who had dementia. He would have had to go before a probate judge. And by the way, 10 seconds and I'm close. You won't believe it. Judge Nancy Phillips denied Douglas Wayne Stanley's fraudulent POA. He kept right on using the same one. She did it in the month of September 2003, the last quarters of my mother's life, guarding ad litem case. And I will say this, John Calvin Chandler was appointed to be the guardian ad litem over mother, but Douglas Stanley kept right on and used his fraudulent POA. So there you go. We need your help to deal with the law enforcement, and we've got these documents. They're all typed up.
Thank you for your
Thank you
time.
very
We
much.
appreciate it.
Are you through with the document that I gave you? The order.
We keep this copy.
Okay, that's okay. I'll get another one. I have to have
But
those.
you can we can
It's
take
all
a
right.
picture on the phone and print it out.
What, ma'am?
That, we can take a picture with the phone and give you back your copy.
Yeah, we'll do.
That'll be fine, but I'm gonna supply you with, the documents that,
All right, we have-
okay.
we have
But you
to
can
move
get that
on.
back.
Better move on here. Thank you.
Call the next person.
Yeah. All right, next, Nancy Cook.
Hello, I'm Nancy Cook, and I signed up as a group representing the Board of Aldermen. I am not going to need the 8 minutes, only a little bit over 3 minutes, but I would appreciate the timer not going off. As I said, my name is Nancy Cook. I reside at 3972 Business 17E in Bolivia. Tonight, however, I'm here in my capacity as the mayor of the town of Bolivia on behalf of our Board of Aldermen. First, I'd like to thank all of you, the county commissioners, for passing a resolution at your last meeting in support of historical marker recognizing National Airlines Flight 2511, excuse me, which crashed in Bolivia in 1960. Your actions motivated the Board of Aldermen from the town of Bolivia to follow your leadership, and they have passed a similar resolution, which I would like to read tonight for the record. Although she does not want to bring undue attention to herself, Mrs. Linda Silver Bufano, who lost both of her parents on that ill-fated flight, submitted a detailed application to the North Carolina Historical Marker Program to seek their approval to recognize this historical event. Brunswick County and the town of Bolivia have added their support, and both resolutions have been submitted to the Historical Marker Advisory Committee for their review ahead of the formal hearing on May 20th, 2025. From the town of Bolivia, resolution in support of historical marker placement recognizing National Flight 2511. Whereas the North Carolina Historical Marker Program was established to designate places, events, or persons of statewide historical significance. And whereas historical significance requires primary source documentation and denotes the place, event, or persons who made a lasting contribution to North Carolina history, which must extend beyond local or regional importance. And whereas newspapers and television news networks locally throughout the country and internationally carried the story of National Airlines Flight 2511 en route from New York City, New York to Miami, Florida, crashing into a field in Bolivia, North Carolina, thereby meeting the criteria for the marker. And whereas this crash on January 6, 1960, was reportedly the second instance of a bomb bringing down a commercial airline in the United States and resulted in 29 passengers and 5 crew perishing. And whereas family of those who perished on that flight approached the town of Bolivia Board of Aldermen to thank the citizens of Brunswick County in Bolivia for assistance in the days and weeks following the crash, and to seek support for a historical marker through the North Carolina Historical Marker Program, a part of North Carolina Department of Natural and Cultural Resources. Now therefore be it resolved, the Town of Bolivia Board of Aldermen fully support the efforts requesting the placement of a historical marker identifying the nearest location publicly available of the crash of National Airlines Flight 2511. Witness my hand in the corporate seal of the Town of Bolivia, North Carolina, signed this 8th day of April 2025, Nancy B. Cook, Mayor, and Mary Etta Hewitt, Town Clerk, Town of Bolivia. Thank you for your time.
Thank you, Mayor Cook.
Mayor, if you could email an electronic copy of that to our clerk, she can include the whole thing in the minutes. That'll probably be easier than.
Okay, seeking approval of the consent agenda. Do I have a motion?
I'll move approval.
Frank Williams, a second?
What? Oh, okay,
Oh, that was for the change earlier.
yeah.
Yeah.
All right, so
As previously
Williams and
amended.
Cook. Any comments? All those in favor, please say aye.
Aye.
Aye. Okay, moving on to presentation. Mr. Stanley.
Thank you, Mr. Chair. I'd like to introduce Cecilia Piers with Trillium to come up and give a presentation.
Welcome.
Thank you so much for having me in today. I appreciate it. As Mr. Stanley mentioned, my name is Cecilia Piers. I am the Southern Regional Vice President with Trillium Health Resources. We are your local management entity and managed care organization, covering Medicaid benefits and state-funded benefits for people with the most significant mental health, substance use, and developmental disabilities. And I'm just here, as usual, providing an annual update on some of our activities as an organization over the year, some changes with Medicaid in North Carolina, and some catchment-wide and local data. Just wanted to remind you all of Trillium's mission. It is transforming lives and building community well-being through partnerships and proven solutions. Because Trillium does not provide direct services, we really do rely on partnerships with our provider network and of course with our counties, county organizations, local nonprofits, all of those partners that play a role in building the health and well-being for our members. Because we don't provide direct services, members can access those services through our network. They can contact us by phone or go on our website to find a provider. So a little bit about Trillium. It's our consolidation with East Point and Sandhills last year in February. We are now a 46 county regional and local management entity. Our area covers the total population in our catchment area is around 3.1 million. And if you look at the map in comparison with our LME MCO Neighbor Alliance in pink, their region covers 3.5 million. So you can see we have a very large area of land to cover for our members, a lot of it very rural. And so we have to be creative with the services we provide, and the services that we provide have to look a little bit different than the services that are offered in a more concentrated area. So you can see the summary of our members by number, 51,000 approximately tailored plan members. Those are those members that we serve that are eligible for whole person care. 163,000 approximate Medicaid direct members. Those are the folks who are eligible for behavioral health services through us, and they receive their physical health services through another network. Typically it's Medicare, and there's other populations that are carved out of that managed care. And we're still working with around 280,000 or so uninsured members who are receiving those state-funded benefits for their behavioral health. So because we are 46 counties, and you all are familiar with this model because we've had a regional model for a while as Trillium, we established 5 regions after the consolidation so that we could still continue to focus on a smaller number of counties with local staff, so that we could understand the needs of our counties and have local governance in addition to our governing board. And so we really appreciate Commissioner Cook for continuing to serve on our regional advisory board, as well as David Stanley, and his service on our governing board for years is very much appreciated. So we're really happy to have Brunswick County as a partner in that way. We also have 3 members from Brunswick County representing the county and the region on our Consumer and Family Advisory Committee, and they represent substance use, intellectual and developmental disabilities, and traumatic brain injury. We still could use a representative for the mental health population. So if there's anyone that you know of, or anyone listening who would like to share their experience in accessing those services, we would welcome them on that committee. I'm your regional vice president. We also have Dina Hamilton in the audience, who is your community liaison. Terrell Alston covers, essentially there are 2 community engagement and empowerment staff. Terrell is assigned to this region, but he also covers a couple of other regions, so he couldn't be with us tonight. But we try to have a robust regional staff so that you have individuals that you can contact, ask questions, and we're ready with information when you need it. So just a little bit about revenue for the last full fiscal year. It was around $1.2 billion. The majority of those funds, around $949.5 million, came from Medicaid services. We are required by the state to have a risk reserve, and that's at about 0.2%. Those state-funded services were funded at around $129 million. So you can see the significant difference between the funding that comes in for people who still have no insurance or are underinsured for their behavioral health services, and what's funded through Medicaid. And then, of course, we appreciate the county's contribution to local efforts, to our training efforts with CIT, mental health first aid, and other trainings that we administer. And we had around $143 million in administrative costs to operate the organization, which is around 11.6% of our total operating costs. So we looked at some numbers just starting in July when we became a tailored plan and started covering those physical health services because they are significantly more expensive and increase our budget significantly. And so just to provide a quick snapshot, we had around 80,000 members who were eligible for those services. The breakdown in terms of disabilities, around a little over 57,000 people receiving mental health services, a little over 15,500 receiving substance use services, and around 18,500 receiving services for intellectual and developmental disabilities starting in July of this year. And so just that half a year in terms of expenditures, we were at about $802 million. The expected budget overall for the year is around $2 billion. So that's a significant increase, and primarily that's a result of us covering those pharmacy benefits and Medicaid physical health services. So I covered a little bit of this information in my last kind of mid-year update when we were getting ready to launch tailored plans, so I won't go through it too much. One of the main lessons learned and things that we experienced when we launched as a tailored plan was just the increase in call volume. No matter how many pieces of information we send out to our members, things are going to get missed. And so a lot of our members and providers called when we launched Tailored Plan and shortly afterward to get information. What is care management? Why do I have a new Medicaid card that says Trillium? How do I get a primary care doctor? So we were in the process of answering those questions for a while. That call volume has dropped down to around 13,000 calls per month, and we are able to now respond at a rate of around 12 seconds per caller, which is much better than when we first launched. So we've reduced that time significantly. And as a reminder, the standard plans that cover individuals who have Medicaid and have mild to moderate behavioral health needs, those are listed at the bottom of this slide. And so North Carolina has been going through this Medicaid transformation process for a while. This is a quick refresher. The last part of that process, which is expected to happen in December of this year, is the Child and Family Specialty Plan, which we're calling the foster care plan, because it is really designed as a single plan covering the entire state for children in foster care and their families. And that is the state approved the RFP from Blue Cross and Blue Shield to launch that plan at the end of the year. So Trillium covers around 28% of individuals who have Medicaid throughout our catchment area. The other 72% of individuals are receiving some sort of standard plan set of benefits. The majority receive that through Healthy Blue, and you can see the breakdown of other standard plans. In Brunswick County, your Medicaid enrollment is around 10,000 members, and we're serving around 31% of that population. Around 10% are those tailored plan members receiving the whole person care, and still around 20% are receiving Medicaid direct, particularly because you have a larger population that are dual enrolled with Medicare and Medicaid. And so we're only providing the behavioral health services when people need them and access them through us. So a couple things that Trillium has worked on over the last year or continues to work on. Through some of those county contributions, we purchased naloxone kits. Those go right back out to the health department and your county agencies who need them to help prevent overdose. We also started purchasing and providing xylazine and fentanyl test strips so that people can, if they're still actively using, can test what they're using so that they don't experience symptoms that they're not expecting. Sorry about that. We were able to help get an Oxford House for recovery opened here. We have partnered with the state on Chess Health, which is an app that people in recovery can use to support their recovery efforts. You include your recovery plan. You can get reminders, access to meeting information, just another tool in the toolbox to help people who are in recovery. We are contracting, continuing to contract with Coastal Horizons for their mobile behavioral health unit. Members in Brunswick County are eligible if they have Medicaid for Healthy Opportunities pilot services. So those are the services that support social determinants of health needs like food access, short-term housing assistance, education and employment. Some of those things that help with overall wellness that Medicaid has not traditionally paid for, but now we're trying that out as a pilot. And so far it's been effective. It saves on average around $80 a month per person who is participating in the pilot. It saves $80 in their healthcare costs. And then we've also continued to partner with Victory Junction to host inclusive family weekends at their camp in Randleman. So families where an individual that we serve wouldn't normally get to participate in camp, they get a weekend away. All of the activities are inclusive. And so it's just a great way for our families to relax when they are often burdened with the stress of caring for loved ones. And then just some quick numbers in terms of members served in Brunswick County, just for that July through December time period where we have launched as a tailored plan. There were around 3,200 individuals that we served, a little over 2,000 for mental health needs, a little over 1,000 for substance use needs, and 563 for intellectual and developmental disabilities, which includes traumatic brain injury. And the value of those services was around $30 million. So we always want people to be able to get a hold of us if they need services or think they might be eligible. And so the main way to do that is to call our member and recipient service line. If someone is experiencing a behavioral health crisis, they can call our behavioral health crisis line. We will answer any call to that line regardless of who your insurance company is. We can always dispatch mobile crisis. That's a service that's insurance blind. And so they will come to an individual who is in crisis with a response time of no more than 2 hours, hopefully less. And we also have clinicians that staff that line that can help people get connected to care. And then we just assess the urgency of need whenever anyone calls. And of course, if we don't remember any numbers for behavioral health crisis, you can always call 988. They will connect people either to resources that they have in their database, or they often will connect with our call center as well. I'm happy to answer any questions.
Are there any questions?
You mentioned the mental health position on your board. Does that person need to be a mental health professional, or can it be someone who's otherwise involved in the mental health community?
That's the Consumer and Family Advisory Committee. And so that committee is made up of people who are either caregivers for someone who is receiving services, or a person with lived experience with that disability.
Our next item on our agenda is our Substance Use Addiction and Mental Health Commission. And I see a few of them in the back. I wonder, they may know someone who's on that commission or otherwise. Or David, seems like a natural segue, but it'd be great to get that position filled.
We'd be happy to have a recommendation, and we're participants in the commission, so I'm gonna stay for that as well, and happy.
So you know where to find them.
Yeah, exactly.
Thank you.
Got a quick one. Do we have the behavioral health line listed with 211 if someone doesn't know, or does the 911 centers, do they also have that number as well?
The 911 centers do. I'd have to check with 211
Okay.
to see if our number is listed. 211 generally has the information for all of the LMBMCOs, but I think sometimes with 211, you have to make sure things are updated. And so I'm happy to check on that.
It's
to
just
make sure.
always these numbers everybody's got to remember. And so it's like,
Want to cross list everywhere
yeah,
we can.
that's right. Yeah,
Correct.
thanks.
Yeah, great suggestion. Thank you.
Thank you.
Any other questions?
Thank you.
Appreciate
No,
you.
I'm good.
Ms.
Thank you.
Pierce, thank you so much.
Thank you.
Mr. Howard, come on down.
Sounds like a game show. Good evening, Mr. Chair, Commissioners. It's my pleasure to introduce to you a couple of members of your Substance Abuse, Mental Health and Addiction Commission. Mr. Torbich, Josh Torbich, who is our chair of the commission, and Laura Truman are going to present some updates and insights they've been working on for the past 3 or 4 months around youth and prevention services.
Mr. Chair, Commissioners, good to see you tonight. We really appreciate the opportunity to come and share. Laura's going to do the presentation, but I wanted to paint a picture in about 60 seconds for you. Something really personal to me, something I've enjoyed having my hands on that speaks directly to the heart of the presentation tonight, which is themed around prevention efforts inside of Brunswick County. I represent as well as CEO of Christian Recovery Centers, a local group serving about 200 residential beds inside of our community with substance use disorder treatment services and recovery services. And over the past 7 years, we've had the opportunity to go into the local schools and do presentations for the kids. And one of the more impactful experiences I had happened this past year. At the end of one of our presentations, one of our 18, 19-year-old folks who volunteered to come out and share their personal story finished with a segue talking about how they grew up inside of a household that substance use had plagued, essentially. One of the young ladies on the bleachers got up, subsequently walked down to the front and handed over a vape pen that she had in her pocket right over to the person on our team who was presenting. We had dialogue with that person, went on the next level of conversations. She was able to share about a home that she was living in that was plagued with substance abuse as well. And about 3 days later, her father ended up checking into one of our facilities. I wanted to give you that token because of the good work that not just us, but obviously so many other groups are doing to push back and get down the river on this thing that's plagued our society. You know, everyone understands what it looks like for treatment, recovery, reentry services, very reactive response to a problem in our society today. But the things that you'll hear tonight go straight to the core of us trying to make sure that we don't continue to see larger problems downstream from us. So I thought that would be great context while you guys get to hear from Laura. Thanks again for the commission and the efforts that you guys have tasked us to be a part of.
Thank you, Josh.
Great. Good to see you all again. It was last June that we last talked. So we have 5 new commissioners since our commissioners. You all are steady since we started. And so if you could get, do I operate this or someone else does? I operate it. Okay. No.
We need a battery.
I'll keep going while they figure it out because you've got it in front of you, right? Yeah, you're moving there. Great. Okay.
Yep.
Okay.
So anyway, 5 new commissioners. And I'll just say that on this commission, we have people who have lived experience. We have a parent now who's lost a young adult son to overdose. We have an employer who has a painting company and deals day to day with people dealing with addiction in his employment. And you can see we also have Board of Education. We have Cecilia Pierce, who just presented. So we have a good, strong component. And I come to it from 40 years in Washington, D.C. as a public policy professional in healthcare. The last 4 of those were serving the first Trump administration at the Department of Health and Human Services, working on the opioid epidemic. And as you recall, that was a very major initiative for the president then. So what I'd like to do now is tell you some good news. And we don't usually talk about substance abuse and have good news to report, but we do right now. So next slide. You can see in North Carolina, we are seeing a drop in overdose deaths. So this past year, 2024, it went down. Next slide. And if you look at that, the bars on the bottom left there, you can see that for 2024, it looks like for the state of North Carolina, we're down 27% in overdose deaths. And the previous year, we were only down 4%. So to have that kind of drop is remarkable. Next slide. Now, what about Brunswick County? Are we tracking with that kind of a decrease in overdose deaths? Well, not quite. First of all, we don't have overdose death data for Brunswick County. It's still too provisional. What we have is a proxy, which is visits to the emergency department for overdose. And as you can see, we had 98 in 2024 compared to 110 the year before. That's about an 11% decrease. So we're not seeing 20% plus, but we're headed in the right direction. So that's good news. All right. Now, our focus tonight is on prevention and youth, because when we did a survey last year, what people said to us is, gosh, it's great that we treat the problem after it starts, but make sure that you don't ignore how do we encourage, especially youth, not to get this problem to begin with. So in the compendium of prevention, treatment, recovery, reentry, we want to talk to you about that first building block tonight with a focus on youth. So the first question is, what does prevention look like in a community? Well, there's the obvious stuff, what I call direct education. You know, that's stuff that happens in the schools and with youth groups where they're talking about drug education. But there's also these upstream interventions. You know, if you don't have good childcare, your kid is out running around on the street as a latchkey kid. That's not good. If you don't have enough ball fields, or if you don't have enough civic organizations, if you don't have enough mental health care. So all of these softer things that help kids thrive, help communities and families thrive, also need to be in place. So in terms of looking at what's happening in the schools for that direct education component, you've got education going on in the elementary school, middle school, and ninth grade. You've got the once a year monthly activities, and which includes the CRCI presentations Josh just talked about. You've got the Brunswick County Sheriff's Office coming in for 5th grade for 10 lessons. And then sort of a softer side support is communities and schools that try to help kids falling behind in school and may help with this. All right, next slide. So the whole bouquet of youth are not all particularly vulnerable. Who is vulnerable among our youth for substance abuse? Well, for starters, kids in foster care are very vulnerable. Kids with involvement already in the justice system. And of course, if you have a parent or a guardian with substance abuse, people with mental health, youth with mental health conditions, youth that are living in poverty, and vaping is indeed a gateway towards substance abuse. So those are some of the risk factors. Let's look at that first cohort, next slide, about foster care, because this has something very, a little bit disturbing in my mind for us in our county. So in our county, out of about 200 in foster care, 61.5% of them, this was in 2023, parental substance abuse was a contributing factor. And you can see from those red bar charts and the other one, it's not been something that's declining radically. So next slide. This is how we compare to other counties in North Carolina. We are in the red zone. We never want to be in the red zone on anything, but we are on this. So statewide, it's about 45% of the kids in foster care are there in part because of substance abuse among parents. For us, it's that 65 or 61.5%. So we have a bigger problem here that results in kids being in foster care. All right. We talked to other people in the county to get input on these vulnerable youth populations. So Judge Pauline Hankins, she had 3 ideas about how to help justice-involved youth. And they really revolve around making sure there are clinical assessments, in-person services, on-site assessments, and family education programs to engage with these kids right from the get-go when they enter that system. Then we talked, Cecilia got us good input from the Trillium Youth Care Managers. They had 4 ideas. One is more local residential providers at higher levels of care. If you're a kid in a youth, in a mental health crisis, you're going to have a tough time finding a residential placement in our county, which, you know, if you want to stay connected to your family or anything else is problematic. There are terrible stories of people waiting, you know, young people and adults waiting in ER departments for days, even months, to find a placement in a hospital for mental health care. Oops. Thank you. Mentoring programs. Do you know we don't have boys and girls clubs here? We don't have Big Brother, Big Sister here in our county. One of them, there's some in New Hanover, but none here. We could really use those mentoring programs. A safety initiative for youth who are vaping to prevent further substance abuse and increase naloxone disbursement and education. All right, next. So we're giving you that information. We like to give some action item steps to follow on those. So I'd like to just give you 3, probably more like 4. So I'd say we listen closely to Judge Hankins and look at making sure that it's a seamless transition for people who need substance abuse care, clinical assessments, all that on site. One of the things when we did a little bit more discussion on this is, oh, okay, well, if you're Medicaid, you're covered. But if you've got a copay or a deductible, that family may have trouble because they don't have the copay or the deductible. So things like that to make it so there's not a problem. Public schools. So last year, the state passed a new curriculums for health education. It's a perfect opportunity for there to be a working group of the public health people. You've got great county people. We've got great people in the private sector and the school system. Sometimes those 2 operate in silos to get together, look at what we're teaching the kids. Is it evidence-based, the best stuff? And then also to look at what happens in a school when a kid is caught with drugs on them. What, you know, there's the disciplinary aspect, but then what also happens in terms of connecting that kid and that family to a good intervention for substance abuse. I've talked about assign somebody, look into trying to get some youth mentoring programs in our county. And then lastly, not on here, but I would say this issue of having more families in the foster care system with substance abuse is a concern. And that is going to be a larger conversation, but I think there should be some sort of action plan that we come up with to try to address that. And surely there are counties who have had more success in that area. That's all we have. Happy to take questions, comments.
Any questions?
Thank you.
Yes, Sam?
No? All right,
Thank you.
Thank you so much.
you're welcome.
Thank you, Josh. All right, moving on to a public hearing. Mr. Batten?
Bond counsel for a parent company of Novant Health is here to conduct a public hearing. As anywhere the bond funds are to be spent, they are to have a public hearing before the local board of commissioners. I'll ask them to come up.
The short has to do with federal tax law, which is not the most entertaining subject. But my name's Charles Boyer. I'm a representative of the National Finance Authority and Novant Health. We're bond counsel on this bond issuance. Our request to the county is to please hold a public hearing and then approve the issuance of the tax exempt bonds only for the purposes of section 147F. That's the federal tax code. And the applicable law governing the National Finance Authority. These are procedural tax approvals. So in this case, this project will span 10 counties in North and South Carolina. So we're going to each one of those counties to have them host the public hearing for the facility that's in the county, in this case, Brunswick Medical Center. The most important part for you all is these bonds will not constitute a debt of the county. The county will not have any obligation to repay the debt. It's just the venue for the public hearing for the host for the public hearing. And I've shared copies of the resolution with the county clerk, who had shared it with your attorney and staff, and I'm happy to answer any questions or let you all move on with the public hearing.
Anybody have any questions? Any questions on this? Sam?
I do have one.
Okay,
So tell me what the benefit is to Brunswick County?
So the benefit is in order to these bonds to qualify for the tax exemption is that it has to be capital projects. So they'll be spent, this will be funds spent at Brunswick Medical Center.
Okay. So do the bonds, so I'm assuming they'll go out and sell the bonds.
Yes, Commissioner. So the bonds will be sold on the public market. And these projects, the TEFRA notice that we published in the local paper describes all the various projects. For your purposes, it's Brunswick Medical Center, which the approval here is for energy projects and routine capital expenditures. So that's spending on physical assets in the county for the benefit of the county's citizens.
Sure. And as a nonprofit, they can sell the bonds in public, for public.
Yes, so under the federal tax code, a nonprofit can do what's called private activity bonds, which allows them to sell them on the public market with a tax exemption because of the benefits to the local communities and people. So 501c nonprofits are one of the categories that are able to do that.
Okay. All right, I'm good.
I'm on the board of directors for Brunswick Nova, and we're gonna be discussing those capital improvements this Wednesday morning. About,
You probably need to be recused from this.
one of the questions I'm about to ask, because I'm on the board of directors of Brunswick Nova, do I have to be recused from this vote?
I think it's safest to do so.
I'll go ahead and make a motion to recuse Commissioner Forte from this vote.
Need a second?
Second.
Williams and Sykes, all those in favor?
Aye.
Aye.
And the vice chair gets to preside for the remainder of this portion. Good luck.
Okay. So do we have so what's the process here, Mr. Attorney? We have,
If he's concluded, if you could open the public hearing and ask for any comments from the public.
okay.
Yes, so I provide a script. Once I'm done and you do the motion or however you would normally open your public hearing, close the public hearing, and then your standard, after that, your standard approval process for the resolution provided, Commissioner.
Okay. Are you done?
I'm done. I just
Okay, well, hear a motion to go ahead and open the public hearing.
So moved.
Second.
Motion.
Okay. All in favor?
Aye.
Aye. Okay, public hearing is now open. Do we have any members of the public want to speak in regards to this matter?
Marty, nobody signed up.
Okay,
But if
I don't
anybody,
have a list, so all right, so then I would hear a motion to close the public hearing.
Motion to close.
second,
All in favor?
Aye.
Aye.
All opposed? All right, public hearing is now closed. Now where we proceed.
If you could, I'd ask for a motion to approve the request.
Okay, I'd like to hear a motion to approve the request.
before I make a motion on that, Mr. Attorney, you've reviewed this. There's no liability of any sort for the county. This is just a procedural thing. Is that correct?
Correct, sir.
And no financial obligation for the county?
Correct.
I'll make a motion to approve the resolution.
I'll second.
All in favor?
Aye.
Any opposed? And passes. Okay. And now we're back.
Thank you, Marty. Mark that.
Not ready for prime time here.
All right, other business?
Go ahead. No, you go ahead.
I'm sorry. I guess I need to look down on that end before I start jump. Earlier today, I sent a message to our deputy county manager, to look at several items that were related to either committee approved or Senate approved at our state level. I think I only had 3 items on my list, even though I'm sure that there are more. And I just, wanted just a real brief summary back from what my goal was to look at those items that I had mentioned and any others that might be out there that might not be very beneficial to Brunswick County and the residents of Brunswick County. And so that was my whole intent of requesting information back.
And I did not receive that email, so if you could tell us what the bills are as well, so we'll know what those are.
Sure, absolutely. So there's at least 2 bills that staff has done some research on, and our Health and Human Services Director, Kathy Litch, is here, and David McIntyre, Emergency Management Director, is here as well. And the highlights of the bill, I'll start with House Bill 675.
675?
675, correct. And that particular bill, it now rests in the Regulatory Reform Committee with the state. What the bill appears to do is it has the certifications for paramedics and those with medical responder type certifications in the state to actually obtain a national certification rather than the state certifications that they have now. As far as impact to our staff, just looking at some quick numbers, roughly 20% of our staff has a national certification. The rest are state certifications, but what adds to some complexity with that is if your certifications that you currently have, if it's 10 years since you've actually had that training for those certifications, it could be that you have to start all over again with programming in order to set for the national exam. And that could be over 1,000 hours that some staff would have to go back and retrain themselves on in order to be able to sit for the national exam. So that is a concern. The other staff that we have that fall from the 10-year mark to the 2-year mark as far as their last certifications that they have, it is believed that they would be able to do about 120 or 140-hour refresher course that they would need to complete in order to be able to set for the national exam. And so for us, staff would view this as a mandate from the state. It would cause additional expense for us to staff the training and the overtime and trying to be able to manage the retraining while we're also conducting our normal operations with keeping the trucks on the road. So that is a concern that staff has expressed on House Bill 675. Is there any follow-up with that?
No, I mean, I'm good with
I have a
that.
question.
Yes, sir.
Who came up with this idea anyway?
Our legislature?
Well, I'm just saying, I mean, what we have works very well. And now what they're going to do is put an undue strain, not on our county, but on counties throughout the state. Have they not at least considered that perspective?
It was introduced by a representative from Haywood, Madison County area. I don't know which one of those 2 he lives in, but
Yeah,
I don't know him.
I've only met him one time, and whenever I was
And
up in
so
Raleigh to talk to the
one
western
other
counties.
detail I've expressed kind of from our point of view, our EMS system. I would like to also say that this medical responder certification, there's many of our local fire departments here and across the state that would also come under this as far as their certifications. So the fire department certifications for their medical responders would also need to be nationally certified.
I don't know if this is still true or not, but I mean, I used to take, well, I was an EMT for a long time, and I used to go into the Grand Strand Hospital, and we still were certified with our patient because we were dropping them off. And so we still operated within those auspices, but we were North Carolina certification. And I'm sure that's probably the case with respect to our paramedics. So the point being is, I really scratch my head as to why we would even be entertaining this at the state level. Is there anything we can do to send some kind of a request that they reconsider this thing?
Well, I would certainly think that that's a decision that y'all can make if you would want to send some comments to the delegation.
Let's hear the other bills first and then come back and discuss that because I'm inclined, but it might all be one letter.
Yeah.
Right. So another, on the EMS side, another closely related bill we might want to take a look at is House Bill 219. And that's a bill that essentially allows for EMS providers to operate in counties without the franchise agreement. So basically, the franchising agreements that you typically issue once a year, all the franchises that we have, that goes away and folks would not need to apply for franchise agreements in order to be able to operate. And so some of the obvious concerns you would have with that could be when we try to work within a system in the county, you make sure that all the certifications are similar, the training's similar, the standards are similar, you're working under a common medical director. And I think not having franchise agreements and folks being able to operate how they see fit personally, I think it lends itself to confusion and being able to provide the best care possible that we could in the county. And so that's another concern that we're hearing from some of our EMS providers in the county about that House Bill 219.
Does the bill require that anybody else certify them, or are they just able to just show up and start transporting if it passes?
I would have to go back and look at the language in the bill. My assumption would be there is some certification that they have to work under some license because there's other laws that would direct that. But one of the benefits of working in one system in the county is you do have that one medical director that the quality control, the training, and all those pieces flow from.
This bill has the same sponsor as the
Yeah,
first bill too.
It does, yeah.
I believe so, sir.
It does. I just checked.
Yeah, I've
Yeah.
just checked it
Yeah.
too.
Any other bills or those?
Oh, we've got a plethora.
I only gave him a couple, guys.
So another one that we might want to take a look at is actually Senate Bill 257. That's the large bill that's already been passed by the Senate, and it is over in the House now. And one of the questions one of the pieces that bill does is it essentially takes the state emergency management functions that the state emergency management does and allows the response piece of that to be handled by an adjunct general with the National Guard.
What was that bill number again?
That bill number is Senate Bill 257.
That's
That's
the appropriations.
that's the
bill.
big appropriations
Yeah.
bill. So
Correct.
that's part of that.
It's,
Okay.
it's buried in the appropriations bill.
Right.
So they won't take it out.
Well,
It's already passed then.
the Senate won't take it out, but the House.
Yeah.
House could.
The
It-
House
In
can.
that bill, it's kind of between page 307 and 310
Okay.
is where the language is.
Page 307 to 310.
Yes, sir.
Mhm.
And so some of the particular concerns with that is our staff has looked and David's here. He can certainly, he has done a lot of the research for us. And no other states we've been able to find have this particular model. And so sometimes being the first isn't always a great thing. So that's one piece that we usually like to do when you're changing a major model in the state to something that's new. Are there others out there that we can kind of learn from the good and bad and the ugly with that process? And we've not been able to identify other states that have this particular model. Another concern would be if the National Guard is in charge of the response. The question would be if under their federal call-ups under Title 10 or Title 32, would they be able to actually provide the resources for the local or the state response as well as the federal response that they might be asked to support. There's another,
Bill was that?
It's 257.
257.
Oh, you
Senate.
still talking about the same
Senate Bill
one.
257. Yes, ma'am. There's another concern in that it states that the general will be able to enact local plans, enact state and local plans. And so, you know, there could be a question with that, with some of the specific nuances we have here being a coastal county of North Carolina with hurricanes and the evacuation measures is just an example. How would all that work with a general being able to activate local plans? And again,
This idea.
It's
It
the
came out
same.
of the Senate, but it's in a big 300-page bill, so I don't know who
Yeah.
put it
But
in there.
I mean, it's like, I can't even understand why anybody would even fathom to do either one of these things that they're talking about tonight.
and then finally, it doesn't, the language really doesn't speak to the existing framework of the emergency management system in the state. Where do those folks go and what will they be responsible for? So, you know, I'm sure there's a lot more in there, but those are kind of the highlights that staff, we had talked about today on that particular bill. And again, it's already passed the Senate, so it's the budget bill that would be over to the House.
David,
North
I have a-
Carolina emergency management is known for being pretty much the preeminent emergency response in the nation. And what we've done, we've gone to places like Hawaii where nobody else was even asked to go. We were asked to be at a stay at Puerto Rico when they had a disaster, and nobody else was asked to stay. Well, this happens over and over and over again. North Carolina does an excellent job in what they do. And now what they're going to do with the stroke of a pen, basically, because of some individuals up there probably not going to pull it out or it's buried in some big bill. The truth is, you're going to potentially put that in jeopardy. Am I not correct in that? You've served in this for a long time, and I would
You know,
submit that the
my-
way it works.
I guess my biggest concern is the same thing's going on at federal level. You know, sometimes, and I would be the first to suggest that there probably does need to be some tooling of operations and response, but to totally dismantle and change direction and put it under someone that doesn't deal with emergency response, would be detrimental to the state. So I agree. I think the big key here is the reason why I brought all these things up, and I think there's one more for Viper and a user fee for Viper, which, you know, it might be a small item, but it mounts up over time. And if
Bottom
you
line.
start a user fee, the only thing that's going to happen is it's going to increase over time. So something that all the parties in the county that operate off a communication system were told, hey, you know, this is a user-friendly system. It's not going to cost you, and that's going to turn around and cost you. So, you know, different people in charge. So, my hope is that we would just suggest that maybe that our state representatives in the House be made aware that these items are either there in their house or coming to their house, and we would like some attention drawn to them and their consideration for making sure that these bills are adjusted so they do not impact the counties negatively.
I have a question as well, and then I'll turn it over to you. We wouldn't get the National Guard without a declaration. We don't get a declaration until after the storm has passed. When we know a storm is coming, we have the EOC manned and going for 2 to 3 days in preparation. When is the National Guard, if the governor makes a declaration, how long before I have the National Guard's boots on the ground here? It could be days. So what do we do in the meantime? Are we allowed to do what we've always done and get out and do what we have to do and start making repairs and cleaning up and getting our roadways and everything open? Or are we supposed to sit on our hands and wait for some general to show up?
Yeah, that's actually another question that staff had raised. I haven't shared all of them with you, but that was one in there as well about the confusion created with the declaration and things that has to be done prior to the storm. And, you know, I guess we could presume that between the governor's office and the adjunct general, they would make whatever provisions they needed to in order to do that, but it's not clearly spelled out, and it is confusing right now as the current language to our emergency management staff.
Thank you. Right?
I have a few comments, and on the first two bills that were both introduced by the gentleman from the mountains, 675 and 219, I have three bullets I would think we would want to put into a letter or whatever. One is just the litany of unintended consequences that they have obviously not thought through. The second one, you mentioned this, but I think it's important, is unfunded mandates. And then based on what you were just saying, Chairman Forte, I think the potential or what some others were saying, the potential adverse effect on public safety of having unknown people trying to run EMS in this county that we don't know anything about. Yeah, I want to know that if my 93-year-old dad not dials 911, that whoever picks him up is trained and that they're trained under a legitimate training organization that knows what they're doing. And I don't want Joe Blow that bought a van and stuck a light on top to show up. And we have no idea what that would look like at this point. So the second one on the Senate Bill 257, I think the big thing, there's a lot to mention there, but one big thing we need to emphasize as a county government is the importance of keeping counties as the statutory lead response agency in our county on emergencies. I mean, we've got an emergency management director who happens to live in Brunswick County, not at the National Guard office in Raleigh. And we need someone who lives in this county coordinating and planning our response for this county. And that's what we've always had. And I think that's, you know, I heard at NACO, you've been to one county, you've been to one county. They are not all the same. So those are, if we want to do a letter, I'd be happy to make a motion for us to send letters on both of those. If
Three of them are.
the first, I was going to lump the first two into one since they're both kind of related to
and then
EMS.
do
Yeah.
Two letters.
Yeah, do one letter on EMS, one on emergency management.
Oh, wait, we're not done. What about the Viper?
Well, let's hear that. That might be in one of these, or it might be a separate.
So as far as the Viper goes, and that's one that I think some of y'all may have been doing some more research on that
What's that bill
than
number?
myself.
It's in the same appropriation bill, I believe.
Is
Is it
it
the same
is-
Senate bill?
It's the Senate bill.
Yeah.
Okay.
But my understanding is they're implementing a user fee for every portable radio device. It's $25. And, you know, again,
Is
that's
that per year, per month?
I'm not certain.
I'm not certain either.
When Viper was, I mean, tell Randy, you know a lot more about this. You and Marty do. When Viper was presented with it, were local agencies told that there would be no cost to tap into that, or?
Yeah.
I mean,
Well,
I remember,
As long as you bought the hardware, there wouldn't be
I mean, I think
Well,
$1,000 a radio.
that's an unfunded mandate. It's another unfunded mandate.
we ran into was that, and you tell me, I mean, because I remember we talked about this before you even came in here. And you had foresight on this thing because you knew it was coming and it was a good system. But the thing about it was I did say this to members of the General Assembly, I think the Speaker of the House, as well as to the Interoperability Committee in Raleigh. I said, you charge user fees, you will find your site rental go through the roof. Because it was an agreement. You're going to use our sites like the tower by the EOC or a water tower or whatever like that to put your repeaters on there. Fine. Because it's public safety. We get it. We understand it. But we acquired all these radios. And it's not just because we did it. It's a statewide system. It's the largest radio system in the world with 200,000 users. There's over 250 repeaters across the state. And that being said, we don't charge a repeater site fee, but we jolly well can. So my question is it possible we can send not only a letter, but a strong rebuke saying, do not do this because you're going to adversely affect certainly not only our county, but counties throughout this entire state.
And Mr. Chair, if you may, I have that language on the radios to clarify
Yeah, that'd
how
be-
much and the
Okay.
time and all that. Our distinguished attorney pulled that up for me, so I appreciate that. Each user of the statewide radio system created pursuant to this section shall be charged an annual user fee of $25, except that the statewide radio manager of each county may exempt up to 100 users each year from paying this fee. This fee shall be paid to the State Highway Patrol and used by the State Highway Patrol for costs associated with maintaining and operating the statewide radio system created pursuant to this section.
Is a user defined as every individual that use it, or is every system that uses it?
I think it's every radio.
I think it's
That's what I was
every-
saying.
And as I had put out a thing just before this meeting started, I asked somebody, how many do we have? We have 3,047 of them in this county.
Yeah.
So if you take off the 100 that are fee-free, big, very generous of them, we're looking at over $76,000 in fees for these annually. We'll probably have no choice but to pass that on a little bit. That 3,047 radios, I believe that's just the county. I don't know that that's every single fireman, Sunny Point,
What about the police departments?
right, they all have them. So we're talking a lot of money here.
Every ambulance has got
And,
one.
and you know darn well, they get away with this. Next year, it's gonna be $30 and then 35 and go on and on and on.
I would like to know, as we, if we decide to do a letter or just contact our House members, I would like to know what the association's buy-in on some of this is. What's, what's their research saying? Because, as you just mentioned, it's not impacting just Brunswick County, it's impacting all 100.
Yes, sir.
And it would be nice to know what the association is doing to
I agree.
address this
Yeah.
issue as well.
We'd be glad to reach out to them.
Okay.
At 200,000, is that what you said, 200,000 of them in
Across the
this
state
state?
of North Carolina, yes, it's just, this was 2 months old with just under 200,000.
It's $50 million.
Wow.
I'll be happy to make a motion that we send two letters, one on HB 675 and HB 219 combined, and the other one on all the emergency management and Viper related items. And that those go to all of Brunswick County's legislators, all the members of the committees where those bills sit, or if we can research and also see where they might go next if they make it out of where they are, the entire leadership of both chambers, and also to our local media.
I like the second.
Let me ask, just for clarification, we doing a letter or do you want to do a resolution?
I'd like to do a letter so we can
I
get
think a letter.
letter
to start
because
as well.
we don't have time. We'd have to wait 2 weeks for a
No,
resolution.
I think the
I'd
letters-
like the letter.
the
needs to go
letter
out.
is more of a statement than a
We do both?
resolution.
It might be old news by the time we have our next meeting. I'd like to see the letter out
Right.
This week. Yeah.
Yeah,
soon.
yeah. Letter.
All right, so all those in favor of sending the letter?
I-
Okay. Mr. Stanley, you have your direction on that one?
Thank you, sir.
Let me, just for clarification, just want to make sure I got it right. There's two letters, one dealing with the EMS, Senate Bill House Bill 219, 675.
Yes.
And the other is addressing Senate Bill 257 with the radios and the emergency management.
Right.
functions.
Yes.
Yes, the National Guard.
That
thing,
was
yeah.
my intent. Yeah.
Gotcha. All right.
I think the biggest thing, once it goes out, is to make sure it, maybe if you get the legislators and their legislative assistants email, if you get it their assistant, they're more likely to see it.
Yeah, I agree with that. Talk to the real boss up there.
And that is the truth in most offices.
Yeah.
No, I don't think I've ever encountered having
I don't-
this kind of legislation adversely affect, at least in my tenure, anything like this. And to me, I want to say, what are you thinking? I mean, what in the world are you thinking?
And it's,
I agree, it's an overstep.
they've had about 1,500 bills introduced. It's probably all this stuff happening in the background. And if you're working on a bill over here, you may not even know this is happening over here unless someone tells you. And
So, we're
also,
gonna tell them.
per Commissioner Thompson's, if you can make sure that the association gets all this information as well.
You're done?
I've got one more, but won't you
Ed.
let Commissioner Sykes go and then I'll
I'll do
finish?
one and then you go to yours.
Yeah, go
Back to
for
me.
it.
I've
Yeah,
got-
I just
I've got
got
a
one
couple too.
quick one.
Of the commission. Well.
Yep.
Mr. Bauer?
Well, before we change topics, want to bring your attention to Senate Bill 666. It is authored by Senator Lee out of New Hanover County. I'm working on an email to him briefly. It is about PFAS contamination and to bring down said levels of contamination and provide support to public utility systems. However, what I'm going to be requesting is an exemption for public utility systems who are not producing the chemicals, but all they're doing is pulling it from their drinking water.
Makes sense.
We're good with that.
I'm good with that.
Thank you.
Okay.
Okay.
Yeah,
okay.
Pat.
Okay, I sent all of you email reference to water projects. And I remember bringing this up numerous times in the meeting. And these water projects are projects where citizens have requested water for their road or whatever in a development. And our engineer department has a list that goes back to 2015. These projects were stopped during COVID, if I'm not mistaken. I want to make a motion that we bring these projects back and get them restarted so that those citizens that's been waiting a long time for water can have the opportunity to move forward.
Without having that list in front of me,
Yeah, I'm not.
I'd rather we put an agenda item, one of our upcoming meetings for engineering to come.
You had the whole list. I mean, do y'all not even look at the emails?
I look at emails, but I
I
look
mean,
at
I
agenda
sent it
items
on-
first.
A question, where's the money coming from?
Well, that's what the projects will have to ask. I think that they charge the citizens. That street is, all those citizens are sent a letter. If they want water, then they go through the utilities, and utilities tell them how much it's going to cost. And if they need to finance it, they finance it with the county. They may pay. Is that correct?
SAD.
Yeah, SAD, yeah.
That's what they've been doing. They've been, and so that then they get
But
water, but
now
they're paying for it.
I was confused because I thought we were talking about that system where we had in place where we were running water lines down roads where we had like $1 million set aside each year building up to COVID.
A capital
and then
improvement project.
The capital improvement project. And then
Well,
it
you
went
have to
away.
have money until they make the payment because they might not be able to pay the whole amount up front.
But I thought that we put the line
Okay.
in utilizing the funds that were set aside, and maybe Aaron can help us out on that. Is that the way it's been in the past?
There are two separate programs. There is the SAD program that is funded by, and that's typically in wastewater. That's funded by the participants who want to get connected, the cost of the line, and it's handled through, like the tax department to collect those SADs. And it's typically paid up front. It involves their system development fees if they pay everything up front, and then they're able to just, if they pay their SAD, then they're ready to connect. Now, the neighborhood program that we've done in the past that was before that was all funded by the county.
Okay.
And we would run the lines in neighborhoods that were interested, that showed that they would connect. But we paid for the line. The neighborhoods would just pay for, or the people that wanted to connect would pay their system development fees,
Mhm.
connection fees. But Brunswick County paid for the line that ran through. That none of that cost was.
But most of these lines, when they ran them, that was close by to another water line, so it would be easy to connect. So was not a major
Correct.
expense to the county. So both of those need to be moving forward because permanent residents that have been here that started the utilities for water, some of the residents was promised water years ago, have not received it yet. So I think it's important that we continue to support the citizens that are living here.
So last budget year, we started that funding back up and set $1 million aside as part of the approved operating budget. And this year, our plan is to do 2.5 million to set aside in the reserve for this project. And then once engineering's had an opportunity to review that project list, and determine, where people have expressed the interest to connect. I don't have that information in front of me, so I'm not entirely sure who
But
it
you're
is.
saying we have looked at putting 2.5?
Correct. It is going to be in the budget request for this
Okay.
coming year. We're trying to get back on a cycle of $1 million 1 year and then 2.5, 2.5, and then $1 million, 2.5, 2.5. And the reason that is it's about $1 million for design, and then 2 years of 2.5 for the construction. Because it was about 7 million that our fiscal year 16
Mhm.
top 7 projects, phase C and D. I'm probably butchering that, but the last one we did that was used funding from that, it cost
No.
about $7 million. So we're trying to,
Yeah,
over
but
the
that
cour-
was the two projects that was constructed in 2016, which were big projects.
correct, we split
They
that
were
in.
not just a normal road
Sure.
for citizens. That was the one at a big, what is it called?
I'm sorry to interrupt.
No, you're fine.
The 2.5, is that something that we'll hear about on May the 5th at the
Yes.
budget discussion?
Yes.
Are you okay with?
Yeah, we can vote on it on May the 5th.
Okay.
Can we have Bill Penix come and tell us where he would like to put this? What makes fiscal sense?
I don't want to speak on his behalf, but I think he's been
Well, he's out
keeping
of
up.
town this week anyway. isn't he?
Yeah, I think he's been keeping up with
Yeah.
the requests and the surveys of who would connect. So I do think he looks at the percentage of people that
Right,
would connect if we
right,
expand.
most served.
Correct,
Okay.
correct. But yeah.
And I can send the list to you again, streets and areas for the future. It's called Streets, submitted for consideration for future enterprise water main rankings.
Yes, and
program.
that is different than the SAD program.
Mhm.
The SAD program is usually typically a much larger undertaking.
And usually these are done if water is close by, like a development provides water. So anyway, if we could get these two things started back up or whatever to see if we can't get more citizens on our water.
Yeah, so we, like I said, we did take that directive and we're starting to build that reserve back up. This will be year 2 of it. But I don't think that will be, if Mr. Penix can present, the next,
May the 5th, if he's
Yeah,
available.
okay, feasible
be great.
project, then that probably wouldn't be something that will prevent us from moving forward.
Okay, thank you.
Mhm.
The other thing, since it might be small, I don't know. I have concerns again about development in the county and, my planning board representative has resigned. And his understanding is that they are working with an outdated unified development ordinance, which results in the planning board being more of an approval board than a planning board. So my feelings right now with the continued development and then with the legislature not moving forward with the downzoning bill that was there that keeps us from doing anything, I think we need to abolish the planning board and let things sit until the legislature moves forward with changing the downzoning. And y'all don't have to comment or you don't have to make a second, but,
I think, well, I'll say this much. I think that there needs to, I think we need to continue to have a dialogue about this, especially with the House. I'm assuming it's a House bill. I don't know, the bill that's,
Originally, it was Senate Bill 382,
okay,
which I've been told is going away, but it's coming back as 3 separate bills. And the new House bill that they just introduced is much worse than
Yeah.
Senate Bill 382. It's
I-
even more restrictive.
I think that's what we need some guidance on. And then once we have that guidance, we'll know with our UDO, we'll know how to move forward on, because you're absolutely correct. If our planning
Planning board
board
is-
is not gonna be able to be a planning board, then why should it exist? So,
Hey, you're still gonna need them for additions and I don't know that these bills have anything to do with commercial property.
I think if
Heard
we
the
can
word
get some
commercial.
guidance back so
Sure.
that we can make a good decision on that. I've got, one more thing and then
Wait, Pat, you done?
I'll get off the box.
I'll let
good
it go
done?
ahead. I got
Okay.
one more thing. But ask,
You
Mike,
want me to
go ahead. Go
All
ahead.
right, all right. I'm not Beavis, but I'm been hearing rumblings, okay? About the possibility of us having a cafeteria style plan of selecting things in the budget that may include or be attached to a tax increase. Of items that might be needed and recommended for the county. If that in fact is the way in which we're headed in May the 5th in that discussion arena, I would like some information going into that May 5th meeting. I'd like some information on lap salaries for all departments, all offices that are supported with county funds. I'd like to see what kind of numbers we have for lap salaries as of April 30th. I would also like to see per department what type of unspent funds are available on April the 30th as well. I would also ask that staff be very diligent in monitoring any expenditures that may be designed towards preparedness for the coming year. In other words, trying to spend ahead to save reserves in the next fiscal year. So I'd like to make sure that if something is not being spent on county operations up until June 30th, then it needs to be funds that might be available. Because if in fact that we are not going to be able to meet certain needed assets for the county, come our budget discussion, which may lead to discussions of any type of tax increase, then my recommendation would be to utilize lap salaries and any kind of unspent funds percentage that might be there available so that we can afford to go ahead and make the expenditure for those items that that this board deems necessary moving into the next fiscal year without the pressure of having to look at any type of tax increase. That is what I would like the message to go to our manager to try to pull that together. And, but if we could have, if all of us could have that information prior to the May 5th meeting, and so that whenever we get in there and we start talking about dollar amounts that are needed for different projects that are recommended, but don't necessarily have the funds attached to it, then maybe we might be able to find the funds.
Would you like me to pull for the lap salaries and unspent funds? Can I provide that to you as of March 31st?
March 31st
April-
works better for you, sure.
Yeah, April 30th, I really won't have the month closed out.
Okay.
And wouldn't give you enough time to,
You would be able to give me a percentage of what I would be looking at anyway, right?
March 31st would be a much more
Okay.
solid 3/4 of a year.
Now, does everybody
Yeah,
everybody
I would
understand
like
what
a
I'm
copy of
asking
it,
for?
yeah.
Yeah, I'd like it.
Easy enough. Yeah.
Okay, thank you so much. That's all I have.
Okay, the last thing was, do we have an update on Sunset Harbor boat ramp situation where the dredging is needed? Did we ever get an update from anybody?
I can give you an update on the Lockwood Folly. The Sunset Harbor, we're still trying to figure out what's going on with that one as well. But as far as Sunset Harbor, I got some communication from those folks as well. The Corps went out and they did the surveys. So we have an idea of what it would take to dredge it to an 8-foot depth. Total cost of that $744,000 for that project. I reached out to Holden Beach, talked to them about potential cost share and also any potential cost in grants that we may get from the state. So we're looking into that, but at least at this point, we do have a survey that's been done by them out there, and we know what the cost and estimate would be for that project. So we're,
Harbor.
that's Sunset Harbor. Or I'm sorry, that's Lockwood Folly.
Oh, okay.
That's Lockwood
So
Folly.
that's Lockwood Folly.
That's Lockwood Folly.
But we don't have a dollar figure for Sunset Harbor yet.
Now, Sunset Harbor is a little bit different because that is a wildlife project. That's really not our project. So let me bring you an update back on that at the
Okay.
next meeting.
Thank you.
Anything else?
I think I'm good.
Good, I'm good, thank you.
Motion to adjourn.
I have a motion to adjourn. Second, somebody?
Second.
Randy? All those in favor?
Aye.
We're done.